Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID briefings today for November 18th, 2022. If you have questions, please put them in the chat and we'll get to them today. So it's Facebook questions at douglaspublichealthnetwork.org. That is a mouthful, but it still works. We have one question this week is about natural immunity. And the question was more of a comment. It was, why has public health not stressed the advantage of natural immunity? So natural immunity means you have the disease, you now have some immunity to the disease, and that immunity does give you some protection. We have always recognized that that the disease does give you some protection. The protection seems to be very good for about 90 days. But that then does seem to fall off. So we knew with COVID early on that with other coronaviruses, you don't have good long-lasting immunity. So there was some concern that with COVID, you also wouldn't. The other trouble with natural immunity is you have to get the disease. And early on in the disease, before we had really effective treatments, getting the disease was a bit worrisome because there was some mortality. We're still seeing among people who have no immunity the first time they get the disease that there are a certain percentage of people who die. So my point is that natural immunity is good, but it's hard to get. You have to get the disease, and it's not lifelong immunity. So with some disease like measles, if you get it once, you're never going to get it again. But with coronavirus, not so much. When you get it, you have good protection for maybe 3 months, but you could get it again. So natural immunity is okay, but far better to get it through the vaccine where you don't have to get sick. The risk of death is incredibly low. And that's why we're still recommending the vaccine. So the situation for COVID in the world is pretty good. We're sort of a flat number of cases of disease. We've not seen any big outbreaks. There's a little bit of disease in the Pacific Rim with Japan, South Korea, and Taiwan reporting an increased amount of disease, but they're not seeing a lot of hospitalizations and deaths, probably because many of the people have already had the disease or the vaccine before, and they're being prevented from the most severe outcomes, but a fair amount of disease. Europe, which we had worried about, which was really hot a few weeks ago, is now starting to come down. And the United Kingdom, which has really been the best predictor of where we're going to be 6 or 8 weeks from now, is having a relatively low amount of disease. So I think in the US, we might think about having a low amount of disease. In the US, the amount of disease is low and fairly stable. And the areas that we look at, the cities especially, the East Coast cities, is where most of the disease starts and spreads and then spreads to the rest of the country. The East Coast cities and the Midwest cities are really pretty quiet. So Chicago, New York, DC, Houston and Dallas are all pretty quiet right now. And that's a good harbinger for Oregon. Oregon is seeing a low amount of disease. We're still seeing occasional outbreaks, still starting to see some outbreaks in schools, still see some outbreaks in nursing homes. But the number of cases have been relatively low. Our hospitalizations linger in that 0 to 10 range. But again, almost all the people who have been hospitalized are those people who are either not vaccinated or not vaccinated for at least a year, right? So their immunity is down. And people who did not get Paxlovid. So it seems that if you do any one of the three things, if you get immunized, if you've had the disease before, or if you take the Paxlovid, your chance of hospitalization is really quite low. And so we're so recommending that people go ahead and get boosted. The booster's been out now for about 3 months. In those 3 months, we've not seen a single person who has gotten a bivalent vaccine and then needed to get hospitalized. So the bivalent vaccine seems to be very safe and very effective. So we're recommending that everybody get it. The other things that we've heard about in this last week have been about flu and RSV. So influenza goes around every year. The last 2 years have been pretty quiet influenza years because the stuff we use to prevent COVID, masking, distancing, staying home when you're sick, work pretty well for COVID, but they work really well for flu. And so we've had pretty quiet flu years in the last 2 years. This year, the flu year is early and more severe. Again, not so much in Oregon. We're seeing some cases in Oregon, still a lot of disease in the Southeast. So Florida and the Southeast area there has really had a lot of influenza. And so we are worried that influenza, which typically starts in that area, will spread to Oregon over the next few weeks. We're starting to see some cases in Oregon. I think this last week I've had 5 kids who've shown up with influenza. And those kids are sick. They got temperature 103, 105. They're really quite listless. And that's typical of what happens with influenza. Really rapid onset, high fever, and prostration, meaning you just want to lay in bed. For the little ones, especially, they can wind up getting dehydrated because they don't want to eat or drink or do anything else. So flu is a worry. It is protected. You can get protected. Everybody 6 months and above can get a flu vaccine. Flu vaccine is plentiful this year. So please go ahead and get a flu vaccine in addition. The third thing that you've heard about is RSV, which is respiratory syncytial virus. So respiratory syncytial virus is not a new virus. It's been around for many years. But again, respiratory syncytial virus was relatively low in the past few years, but is really starting to rise and rise early this year. It can be pretty bad. So it's a disease which especially affects young babies, and especially babies who were preemie. And those babies get sick with cough and difficulty breathing. Some of the kids get sick enough that they need to be in the hospital. And a fair number of the ones who get hospitalized wind up needing assisted ventilation, either with CPAP or with ventilation. And so it's really hard when these little babies get sick. There's nothing sadder than watch a little baby with RSV just struggle to breathe. Their ribs cave in, they don't want to eat, they're just miserably sick. Back east, it's been pretty bad. I met with a bunch of pediatricians from Massachusetts earlier this week, and they reported that in Massachusetts, a state that really has a lot of hospitals, had run out of pediatric ICU beds. New York had run out of pediatric ICU beds, and they were shipping people as far away as Washington, D.C. To get care. Now in Oregon, we only have a few pediatric ICU beds in Portland at Randall Children's and at OHSU, and it would not take a big outbreak for those beds to be overwhelmed. And so the governor this week issued an emergency order helping those places to get whatever resources they need in case we happen to get a big outbreak of RSV. We're starting to see a little bit of RSV in the Portland area and Eugene area. Not seen much yet in Douglas County, but I'm certain it'll get here sometime in the next few weeks. So again, the best protection for all of these things is if you're eligible, get a COVID vaccine, a COVID booster, and a flu shot. I got mine early in the season, and I would recommend that everybody do that. Influenza is a miserable disease. COVID is a miserable disease, and you're able to get protected by these vaccines. So please go out and get the vaccines. For most people, they're low cost or free. Please go ahead and do that. For RSV, no vaccine, no treatment. But I think we can prevent that. When kids are sick, please don't send them to school, at least during the time when RSV is out there. Don't send your sick kids to school or daycare, and hopefully we can quell this outbreak of these three things. The good news is that the new variants that are out there for COVID don't look particularly dangerous. And so at least for now, I think if we can get through this winter, we could enter a prolonged good period for COVID and other things. So again, things look good. Please send us questions at Facebook questions at douglaspublichealthnetwork.org. And we'll do this again next week. It's a holiday week, but we'll still be working. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County.